Hi, I'm Dr. Karim with Family and Sport Chiropractic, and today we're going to talk about icing. We have a lot of patients that come in and they ask us quite a few questions about why they should ice. So we're going to go through a few questions here that typically a patient will ask me. One of them is, why do I have to ice and what are the benefits of icing? Really, icing, it's to decrease blood flow to the area, so it decreases the swelling. Also, it's a good pain reliever. And really, to summarize all that, it's to decrease inflammation in an area and to start that healing process. You want to try and apply it as soon as you can. So if you get injured, you want to put it on right away. Experts say, you want to put it within a day or two after an injury, but the sooner you do it, the better. Another question is, how long do I have to ice for? Well, I would say ice about 15 to 20 minutes. Typically, you don't want to do anything less than that, and you definitely don't want to do anything more than 20 minutes. That's kind of the sweet spot, is the 15 to 20 minutes. Obviously, the first 5 minutes, a lot of times it's painful because it's starting to numb up and you're starting to feel a lot of sensation. But once you go through that first 5 minutes, that's where it will numb up and you'll get the benefits of icing. If you go too long, that could actually stop blood flow, so you don't want to go beyond 20 minutes. And I always say you can ice as many times as you want throughout the day. The more you ice, the better. So I always give that rule: 20 minutes on, 40 minutes off for every hour. So 20 on, 40 off, 20 on, 40 off. And the last part, the athletes, they ice after training all the time. The reason why they ice, and the best way to ice really is ice buckets or ice baths or anything like that. And the reason for it is, for athletes, is it drains the lactic acid out or flushes it out of their system. But when you come to ice, you want to try and do ice bucket or ice bath. In the office here, we do have 3 sizes that we do offer. I'm going to bring Nikki over and show you how we use some of these. We do have, I'll start with a small pack. A small pack could be, like if you just got shoulder or a wrist or something that's small. But you typically wouldn't use a small pack for like a neck or back pain or a quad or hamstring, anything like that. This middle size is pretty popular because, as you can see, you can do quite a little bit of the back, shoulder, and a little bit of the front, or some people will put it around their neck. Some people will lay and they'll put it on their low back. You can, here, let's have you turn around. You can do a whole arm. You can do a thigh or anything like that. And then the last size, which I really like, is the long size here. And you typically, with this, if you're doing a neck, let's have you turn, you can do neck and both shoulders, which is nice. You can do an entire whole back. You can do, when it comes to, let's have you turn, legs, you can do it the entire side. You can wrap it around the knee. So this is actually, I like this quite a bit because you can get a large area. But as I said, if you can do an ice bucket or something, like typically you'll do it with hands or feet, especially, you want to put it in an ice bucket than using a pack. Thanks, Nikki. So that's it for icing. If you have any other conditions that you want us to talk about, feel free to call us. Our number is 319-774-3811, or email us on front desk at fnschiro.com. I'm Dr. Karim here with Family and Sport Chiropractic, and like us for our YouTube channel. Thanks.